You selected C. That is correct. It may be that the patient needs all the tests, but it is worth engaging in an open and honest discussion with the mom before proceeding, and engaging in a multidisciplinary team approach, and determining which tests are truly necessary now and which, if any, can wait. Financial counselors are available to provide an estimate of the financial cost to family. Social work helps identify resources available to those who qualify. In reality, the correct answer is C. It is most appropriate to have an open and honest discussion with the mom about why the tests are necessary and which tests are absolutely necessary now, as opposed to those tests which could potentially wait. The other choices were incorrect because they did not utilize a multidisciplinary team-based approach, and they also failed to address the mom's concerns adequately in an open, transparent dialogue. And also remember, you have the resources of financial counselors and social work who are particularly helpful in the acute settings such as the emergency room. And again, let's just review how to discuss cost with families. Remember to be transparent and clear. Avoid using medical jargon that can confuse the families. And be clear and open about your thought process. Share with them the risks and the benefits of the tests and the medications. And you can also call upon and utilize the guidelines to help support your discussion and the points that you are making. And it's always important, just as you did in the case with this mom, to identify her concerns and her worries and to validate them and make them feel real and to provide empathy through that process. And again, we've emphasized this a lot, but using a team-based approach and the resources available to you in your hospital. And remember that families are the most important team members of all. So back to our patient. So you reassess him in the emergency center after giving a normal saline bolus. His oxygen saturation is now consistently 95% while sleeping. He has normal vital signs. So you consult the care guidelines, you recognize that he now meets discharge criteria, so you prescribe him amoxicillin and you discharge him home with follow-up with his pediatrician. Before he leaves, you want to prepare the patient's mother for the bill from the emergency room visit. How high is the deductible per family likely to be given that this family has a bronze level plan? A, $1,000, B, $2,500, C, between $2,500 and $5,000, or D, more than $5,000.